I was watching the Cayman Healthcare Conference and Dr. Sara Watkins presented on the topic optimizing and protecting child health in a post-closure era. A lot of great information was shared, but there were a few things some COVID experts have a different view on. Dr. Claudia Espinosa, who is a pediatrician and infectious disease doctor, was recently on the CMR COVID Spotlight show to tell us more about her experience dealing with children and COVID-19. And here are the highlights. Some people say kids don't need to worry if they get COVID because COVID really affects older people. Is that true?
That is absolutely not true. I can tell you many stories of my patients that they should not be infected and they should have not end up in the hospital and they shouldn't have been in the ICU. We are seeing all type of kids that never had any problems, and we are seeing kids that have tons of problems. So this is interesting about this virus is we haven't figured it out. We haven't figured it out if there is a test or a marker that we can do and then tell parents, go home and don't worry, your child has minimum risk of having complications. Now the other thing is that obviously those who have um, underlying conditions like diabetes, chronic conditions, renal problems, they are going to be a higher risk of having complications, but it's not a direct correlation. One thing that I want to just advise everybody, the number of kids that we saw that were obese in the hospital was incredible. Like, I think that more than other comorbidities, obesity probably was the most common that we will see. So if your child is obese and he has or she has COVID, then be very careful monitoring all those symptoms because those are the patients that most likely will end up in the hospital. Allergy medicine for sneezing should not be used neither in children, especially less than 2 years of age. Cough is an interesting symptom because we tell everybody, oh, don't worry about the cough. The cough, it's gonna just get all the plug out, all the secretions. It was unfortunate, but I saw a kid in my practice, a 9-year-old that was coughing that hard that he broke his vocal cord. We don't want to see what bad things can happen with flu and COVID. So you don't want that to happen to your kids. And so, last year we didn't have a COVID shot, but this year we have for the 12 and older. So those kids should get it. And really, the most important thing, even more than the filters and even more than the circulation of the air, which is very important, it's really the masking. So if everybody's masking and they wear proper fitting mask, then the risk for having transmission in that setting is going to be lower. Obviously, if you are too close to your classmates or your friends and you take your mask off because you are eating or something like that, you are going to be a higher risk too. It doesn't go any other way, any other place. It doesn't go to the ovaries. It doesn't travel. It doesn't go to other places. So there is no scientific basis for any infertility problems. Now, if you get COVID, there are a lot of reports of males and females who have been infertile. And if you get COVID and you are pregnant, there is a lot of more chances that you will lose the baby at some point or have problems than if you get the vaccine. So those are things that people should remember. And then the period, I just gave a talk like last week with some OBGYN doctors, and I was interested on seeing what they say about that. And they say that the period can get affected by anything and everything. I mean, food, stress, a test coming up next week. So there is really not a lot of data that support that the period is going to be affected forever or anything like that with the vaccine.
If you have any follow up questions, you could find me on Facebook, Instagram, or Twitter by searching for PIO Kevin W. Or you could WhatsApp me at 407 267 8402.